Welcome to Networking Tips with Lindsey Storm. Lindsey serves as Program Director for the Pharmacy Technician Training Program at Vanderbilt University Medical Center's Center for Programs in Allied Health. With over 18 years of pharmacy experience and multiple advanced certifications, Lindsey has cultivated expertise in technician education, sterile compounding, and workforce development. Lindsey is passionate about technician advocacy and creating innovative, structured training pathways that support professional growth and retention. Her work bridges education and practice to strengthen the future of the pharmacy technician profession. Please welcome Lindsey Storm.
Today, I want to talk to you about networking, specifically what networking actually looks like in pharmacy and how it impacts your career. Because networking is one of those things people hear about all the time, but it's not always clear what it really means or how to actually do it in real work environment. My name is Lindsey Storm, and I'm a program director for a pharmacy technician training program. I started my career in pharmacy in 2006 at an independent pharmacy in Kentucky, working as a registered technician, initially at the front end, helping with the register and delivering medications. And what really changed my path early on wasn't a formal plan. It was asking questions. I wanted to understand what was happening around me, what the technicians were doing, what the pharmacists were doing, and how everything worked together. Within about 6 months, I had moved into more of a technician role, becoming certified in 2010, and then moved to Nashville in 2011 to work in a pediatric pharmacy, where I started over again at the bottom. And the same thing applied here. Asking questions, staying engaged, and building relationships is what led to more opportunities, more responsibility, and eventually leadership roles. And now looking back, and even in my role today, I can clearly see that networking wasn't something separate from my work. It was happening the entire time through how I showed up, how I interacted with others, and how I built relationships. And that's what we're going to break down today. What networking actually looks like in pharmacy, how it happens in your day-to-day work, and how it directly impacts your opportunities. So I want to start with a question. Why do some people get opportunities while others don't? And I want you to actually think about that for a second, because you're going to see this if you haven't already. You'll see two people start in the same role, same training, same environment. And over time, one of them starts getting pulled into new opportunities. Maybe they're being trained in the IV room. Maybe they're getting exposure to specialty or leadership. And the other person stays exactly where they are. And it's not always because one is smarter than the other. So what actually creates that difference? Opportunities don't just come from what you know. They come from who knows you. Your name will come up in conversations about opportunities, even when you're not there to represent yourself. And I want to slow that down for a second, because this is where a lot of people misunderstand how growth actually happens. In pharmacy, there are absolutely formal processes, applications, interviews, resumes. All those things matter. But what often happens alongside that is conversation. People talk about who they've worked with, who has shown initiative, and who has been consistent and reliable during a shift, and who they believe is ready for the next opportunity. Those conversations don't replace the process, but they often influence how people are perceived going into it. Because when someone is receiving candidates or thinking about who to encourage to apply, they're not just looking at qualifications, they're also thinking about experience. Who have I worked with? Who made my shift easier? Who do I trust when things get busy or stressful? When your name is already associated with those kinds of experiences, you're not starting from zero. You're starting from recognition, and that can make a meaningful difference. Networking is building relationships that create opportunities over time. That's the simplest way to think about it. But what makes this different in pharmacy is that those relationships are built in motion, not in formal settings. You're not networking in a separate environment. You're networking while you're working. Every interaction you have is contributing to how people understand you. Are you someone who asks questions? Are you someone who stays engaged? Are you someone who helps without being asked? Those patterns are what people remember. So networking isn't something extra, it's embedded in your daily behavior. One of the biggest reasons people struggle with networking is because they misunderstand what it is. They think it requires confidence or being outgoing or knowing exactly what to say. But in pharmacy, the opposite is often true. The most effective people aren't the loudest, they're the most consistent. They're the ones who show up prepared, who pay attention, and who follow through. And that's important because in healthcare, trust is built over time, not in a single interaction. So if networking feels uncomfortable, that's okay. But at the same time, you do need to present yourself well. That doesn't mean being fake or trying to impress people. It means being professional, being engaged, and being intentional in how you communicate and interact with others. Because in this field, how you present yourself and how you work go hand in hand. And the strongest networks are built by people who are both genuine and professional. Your network is already around you. It's not something you need to go find. It's the people you interact with every single day. It's your shift, the people you work alongside. It's the pharmacist who answers your question and observes how you work. It's your teammates, the technicians who will grow, move, and influence other areas over time. It's your leaders, the people making decisions about training, development, and advancement. What's important to understand is that those roles are not static. The technician next to you today could be in leadership in a few years. The pharmacist you work with could recommend you for your next role. So every interaction you have is shaping how those people see you over time. Networking matters because it directly influences how your career progresses. In pharmacy, advancement isn't always tied to time. It's tied to readiness. And readiness is often determined by how people perceive your ability to grow. For example, when someone is being considered for IV training, it's not just about whether they can learn it, it's about whether they can be trusted with it. When someone is asked to take on a project or leadership responsibility, it's not just about skill, it's about consistency and reliability. And those decisions are shaped by the relationships you've built. So networking isn't separate from career growth. It's one of the main drivers of it. Your reputation is how your network understands you. And your reputation is built through repeated experiences, not one-time impressions. People notice patterns. They notice how you respond when things are busy. They notice whether you follow through. They notice how you interact with others. And over time, those observations turn into a clear picture. That picture becomes what people say about you when you're not there. And that's what influences decisions. Excuse me. And over time, those observations turn into a clear picture. That picture becomes what people say about you when you're not there. And that's what influences decisions. Networking shows up in behavior. It's not abstract, it's visible. It's asking questions when you don't understand something. It's stepping in when things need to be done. It's supporting your team beyond your assigned task. And it's being consistent, not just once, but over time. These behaviors signal to others that you're engaged, you are reliable, and you are ready to grow. And those signals are what builds trust. A lot of people know networking matters, but they get stuck on one very practical question, which is, what do I actually say? That's why I think conversation starters matter so much, especially early in your career. Most people are not struggling because they don't care. They're struggling because they don't want to sound awkward, interrupt someone, or ask a bad question. The good news is that in pharmacy, you do not need a perfect opening line. You just need to start with curiosity. Questions like, how did you get your role? Work well because they let people talk about their experience. And most people are much more comfortable answering a question about themselves than feeling like they have to perform or impress someone. Questions like, can you show me how you do that? Are powerful because they show humility and initiative at the same time. You're not pretending to know something you don't. You're showing that you want to learn. And questions like, what should I focus on learning next? Show maturity. It tells someone you're not just thinking about today's task, you're thinking about growth. I used questions like that throughout my career. Early on, I asked questions because I truly wanted to understand more. Later, I asked questions because I wanted to grow into the next level of responsibility. And even now, in leadership, I still ask questions because good questions build relationships just as much as good answers do. The point is not to sound polished, the point is to start a real conversation. If all of this still feels a little big, I want to make it as simple as possible. That's where the 1-1-1 rule comes in. One question, one conversation, and one follow up. I like this because it gives people a process. A lot of times, networking feels vague, and when something feels vague, people put it off. But when you break it into steps, it becomes manageable. The first step is one question. That question opens the door. The second step is one conversation. That does not have to be long. It could just be 2 minutes. It could happen during a shift, after a task, or while you're learning something new. What matters is that you are present and engaged. The third step is one follow up. This is where people most often stop too soon. That follow up can be very simple. It might be saying, thank you for showing me that earlier. Or it might be saying, I used what you taught me yesterday and it helped. It might be checking back in and asking one more question after you had time to think. That kind of follow-up shows people that you were listening, that you value their time, and that you are serious about learning. When you do that consistently, people start to remember you differently. Not just as someone who asked a question once, but as someone who is engaged and intentional. That is how relationships grow over time. Now, I want to talk about a few things that can quietly hold people back because sometimes it's not a lack of ability that keeps people from growing. Sometimes it's a habit or a mindset. The first is waiting until you need something. If the first time someone hears from you is when you want a favor, a recommendation, or an opportunity, that relationship is already under pressure. Strong networks are built before you need them. The second is staying quiet because you feel new. I understand that instinct. A lot of people think I need to wait until I know more before I speak up. But being new is actually one of the best times to ask questions and build relationships because people expect you to be learning. That is not a weakness, that is part of the process. The third thing is thinking, I'm just a tech. That mindset is so limiting, and I really want to challenge it. Pharmacy technicians are essential to how pharmacy functions. Your role matters. Your work matters and your growth matters. And when someone believes they are just anything, they tend to make themselves smaller in conversations, hesitate to ask questions, and pull back from opportunities they are actually capable of growing into. That mindset can do more damage than a lack of skill ever will. So if you take one thing from this slide, let it be this: do not wait to take yourself seriously. One reason I like this topic is because networking is not just for one stage in your career. It looks different depending on where you are, but it matters at every stage. If you're a student, networking looks like asking, listening, and engaging. It looks like showing interest, being prepared, and building a reputation as someone who wants to learn. If you're a new technician, networking looks like building consistency. It looks like learning workflows, asking thoughtful questions, and becoming someone others can rely on. If you are more experienced, networking shifts again. At that point, it starts to look more like leadership and mentoring. It looks like sharing knowledge and helping others grow, and being the kind of person that newer technicians feel safe approaching. And I can say that from experience. Networking helped me grow early in my career, but it still matters now. I use it in community outreach, in working with local schools, and in my role as a chair of our state technician society. At this point in my career, networking is not just about what I can learn. It is also about how I can connect people, support growth, and create opportunities for others. So no matter where you are, there is always a next step. I want to leave you with something simple and realistic. Have one meaningful conversation this week. Not 10, not something big or formal, just one. One conversation where you ask a real question, you listen well, and you make a connection. That conversation could be with a pharmacist, a technician, an instructor, a preceptor, a leader, or even a peer. What matters is that you are intentional, because people sometimes hear a talk like this and think, that sounds good, but I'll work on it later. And later usually never happens. So I want this to feel practical. One meaningful conversation this week is small enough to do, but important enough to matter. And once you do it once, it becomes easier to do again. That is how confidence starts. That is how relationships start. And that is how opportunity starts. Your career is not just built on what you know, it is built on who knows what you can do. And I hope what you take from this session is that networking is not something separate from your work. It is not something fake, forced, or reserved for outgoing people. It is built in the way you ask questions, the way you support others, the way you stay engaged, and the way you show up over time. When I look back at my own path, from starting at independent pharmacy to growing into inpatient practice, to leadership, outreach, and professional service, I can clearly see that relationships shape that journey. Not overnight, not in one big moment, but steadily through curiosity, consistency, and connection. So start where you are. Use the people already around you. Ask the question. Have the conversation, because one connection really can change your path. Thank you.